Welcome back. My name is Dr. Carl Baird, and today I'll be showing you the 10 best exercises for degenerative disc disease. Before we get into the exercises, I wanted to talk a little bit about this condition because it's a common condition that adults experience as they get older, and it also has a tendency to freak people out. Again, the name itself is kind of scary, degenerative disc disease. And usually when a doctor diagnoses you with this condition, they show you an x-ray, and the x-rays look super freaky and scary, and you see the arthritis and all the sharp, jagged edges. So first thing I want to do is kind of put your mind at ease and let you know that degenerative disc disease is a normal part of the aging process. You could take an x-ray of my spine right now and you'd probably find a little bit of this degeneration. Now there are varying levels, and when it gets to a certain degree, that's when it starts contributing to some maybe pain and soreness, and it's time to start looking at some exercises. The other thing to understand about the disease is that the amount of degeneration does not correspond to the level of pain. So they've actually done studies about this, which I can link down below, that show that the amount of degeneration in your disc did not correlate to the amount of pain you experienced. Meaning, a lot of people have degenerative discs and they have no pain at all. And then there are other people who have a lot of low back pain, but no degeneration in their discs. So they weren't able to find that correlation. So just because you get diagnosed with the condition and just they show you the x-ray and it looks big and bad and scary, it doesn't mean that you need to go straight into surgery. In fact, exercise is one of the best things you can do to limit impact on these discs and get back to living your life. So that's all I got for you in the introduction. Let's go ahead and get right into the exercises. The best exercises for degenerative disc disease do two things. First, they help ease the pain and stiffness associated with the condition. And second, they limit impact that goes through your discs to prevent this degeneration from getting worse and help you maintain your lifestyle as you get older. So the first three exercises we'll cover today are meant to help ease the pain and stiffness. So we're just going to use gentle movement to help you relieve pain and feel a bit better. So this exercise is going to be the cat-cow. So to perform, we're going to do on our hands and knees, hands right under the shoulders, knees right under the hips, and then we're going to move into the cat position. So we're going to press through our hands and arch our back, tucking our pelvis inward, letting the head hang, and then move into the cow position, which is just the opposite. You're going to rock your pelvis back, drop your trunk and your belly, lift your head up, and you're just going to move in and out of these two positions, just getting some gentle movement in that spine to help ease the pain and stiffness. So that's exercise one, the cat-cow. Our second exercise for degenerative disc disease is a side lying twist. So this is another one just to get some gentle movement into that spine to help ease pain and stiffness. To perform, you're going to lay on your side, hips, knees, feet stacked. You're going to have your hands on top of each other here. You can have a pillow for your head or you can rest it on the ground. And then all you're going to do is take this top arm and reach it behind you. So it should feel like a nice gentle stretch on your spine. Hold it for a second or two, come back and repeat. So it's not a static stretch. We don't just want to hold this position. We want to move in and out, again, because we want that movement to help ease pain and stiffness, get the fluids moving in there. Make sure you do both sides, and there you have it. That's a side lying twist. Our third exercise is another great way to get some gentle pain-free movement to help ease pain and stiffness from degenerative discs. It's called the Windshield Wipers. So all we're going to do, lay on our back, knees bent, with our feet flat on the floor, bring in our feet a little bit wider than the hips, hands out at the side. All we're going to do is we're going to drop both knees to the same direction. So I'm starting with the left. It's okay if your lower back comes up off the ground. It's just a nice gentle twist in your lower back. And bring your knees back the other way. So again, it's just another great way to get some gentle movement in this low back to speed up the healing process and just help with that pain and stiffness. So that is the windshield wiper. Building a strong core is also important in help treating degenerative discs. Now we have to be careful that the exercises that we choose don't actually aggravate those discs, and that's why our fourth best exercise is going to be the Deadbug. So to perform, we're going to lay on our back. Our hips and knees are going to be in a 90-90 position, which just means my hips are flexed 90. I keep my knees at 90. I like to bring my feet back to create a little bit of tension in the leg. My hands are going to be right out in front of us. And now we're going to bring our right arm and left leg down. So what it looks like, my arm stays down. I just tap my heel on the ground here and come back. As we perform this exercise, we want to maintain a nice, strong core, meaning we don't let our lower back arch up off the ground and our pelvic to rock forward. We want to be able to perform this movement, keeping everything nice and engaged to build a strong core to limit impact that goes through our discs. Another great core exercise for degenerative disc disease is going to be the side plank exercise. This is a great way to strengthen the dynamic stabilizers of our spine to limit impact that goes through the discs. We'll start with the easiest variation of the side plank, which is going to be the knee side plank. So all I'm going to do, stack my knees, stack my hips. I want my elbow right under my shoulder here. I'm going to lift my hips up. I want my body in a straight line and make sure my elbows are stacked so I'm not twisting forward this way. And it's just a simple hold like this. I like to hold it for anywhere between 30 to 45 seconds if you can, then switch and do the other side. So there you have it, that's the side plank. Our third core exercise for degenerative disc disease is going to be the Birddog. This is a great way to strengthen muscles of our back or our postural muscles to limit impact that goes through the discs. To perform, we're going to be on our hands and knees, knees right under the hips, hands right under the shoulders. And kind of like the Deadbug where we would do the opposite arm, opposite shoulder, we're going to do the same thing with the Birddog where I'm going to bring my left foot straight back, my right arm right by the ear. And so what I want to do is make sure there's no twisting or rotation of my core. We're going to hold for about 5 seconds, bring that leg and arm down, and repeat the other side. And there you have it. That is the Birddog. Building strong glutes and hamstrings is going to be another important part of treating degenerative disc disease to limit impact that goes through those discs. Just like our core, we want to choose an exercise that's safe and effective, and that is why we go with the Glute Bridge. So to perform, we're going to lay on our back, our knees bent, feet flat on the floor, arms out at 45. Then all you're going to do, you're going to press through your feet to lift your hips into the air. And again, you should feel that contraction in the glutes and the hamstrings, and come back down. This is one of my favorite exercises for pretty much any joint pain. I include it in most programs, but there you have it. That is the Glute Bridge. Improving movement patterns is going to be another great way to limit impact that goes through your discs to treat degenerative disc disease, and that's why I always teach the Hip Hinge to anyone suffering with degenerative discs. And so I'll show you the banded hip hinge variation. There's a lot of different variations of this movement. I just like this one because it also targets the glutes and hamstrings, which we worked on with the Glute Bridge. So to perform, we're going to stand in the middle of our band and hold on to the sides. And then all we're going to do, we're going to start with loose knees. I'm going to reach my hips back, keep a nice straight spine, stopping is rounding forward like that. That's going to make the pain worse. So you want to make sure that you really keep this in the hips. It's a really functional movement that you use throughout your day. You'll notice, and that's why we like to train it. Then you just stand back up, reach the hips back, just till you feel tension in the hamstrings, and stand back up. There you have it. That is the hip hinge. Another important movement pattern to help limit impact that goes through your discs to treat degenerative disc disease is the deadlift. And what I love about this exercise is that it also strengthens those hamstrings and those glutes. That's another important factor in treating this condition. And so why not kill two birds with one stone? So to perform, I like using a kettlebell. You can use a dumbbell, you can use a barbell if you're comfortable. But what we're gonna do is start with the weight right in between our feet. We're gonna perform that hip hinge that we practiced, but once we can't go any lower, we're gonna bend our knees to get to the weight. I wanna keep my hips down, my chest up, develop a little bit of tension in the hamstrings here, and press through my feet to stand up. To get it down, same thing, hip hinge, and then bend the knees to get it down. So just like the hip hinge, we really got to be careful with form on this one, because if we don't do it quite right, it can aggravate those discs a little bit, and that's kind of the art of this. We got to be safe and careful, but also we do want to build strength to limit that impact. So that is the deadlift. That is one of my favorite exercises. And last but not least, we have the farmer's carry. This is one of my favorite ways to build functional core strength to limit impact that goes through your discs and treat degenerative disc disease. To perform, all you need is some medium to heavy weights. You're gonna do a light squeeze on the weight, roll those shoulders back. You wanna make sure everything's nice and engaged, and then all you're gonna do is slow and controlled, walk back and forth. So it seems easy, but it's really important in building that functional core strength in a real world activity like walking, because it's something that we do every day. As you're walking back and forth, just make sure you're not bending side to side. We want a nice strong core here. So that's all I got for you. That is my 10 favorite exercises for degenerative disc disease. Before I let you go, I wanted to remind you that if you do get diagnosed with degenerative discs, it is a normal part of the aging process. It's not always directly related to the amount of pain you're experiencing, and in 95% of cases, probably even more than that, you do not need surgery. So don't let this diagnosis scare you into a surgery that comes with a whole host of other problems. Give these exercises a try first, learn how to move and build strength to limit impact that goes through your discs, and majority of the time that is going to be what you need to start feeling better. So if you have any questions, leave them in the comments below. I am here to help. Thank you so much for watching. This is Dr. Carl Baird with Solving Pain with Strength. Hey, it's Dr. Baird here. Don't forget to subscribe to our YouTube page to catch all our videos designed to help you build the strength and confidence to live active, healthy, and happy lives. You won't find it anywhere else.